The pandemic has had a major impact on mental health in America. Feelings of anxiety, stress, also isolation have left people feeling overwhelmed at one point or another.
And Dr. Ashley Zucker is a child, adolescent, and adult psychiatrist with Kaiser Permanente in San Bernardino. Joining us live now to explain why these feelings are expected to last even after the pandemic. And Doctor, thank you so much for joining us this morning.
Thank you so much for having me.
So tell us about the mental health impact of the pandemic. What have you seen in your patients over the last few years?
Sure. So the pandemic has definitely had a huge impact on our mental health across the board, all age ranges, gender, socioeconomic status, you name it. We've really seen that increase. And the majority of it has been within stress, anxiety, and depression, but also an increase in substance abuse as well.
Yeah, let's talk a little bit about what doctors are saying. They're saying that the feelings of stress and anxiety are likely to stay for several years. Why is that?
Well, I think there's a couple of reasons to, keep in mind. One is that this pandemic has been going on for a very long time. And so as this continues to progress and we're still, not totally out of the woods yet, that lasting impact of the chronic stress that it's having on all of us definitely just doesn't go away overnight. The pandemic doesn't go away overnight either. I think also if you take into account the impact that this pandemic has had on our younger people as well, certainly during important developmental milestones, that can certainly have an impact going into the future as well. And there have been many things that have changed over the course of the pandemic that also will affect us far into the future too.
Dr. Zucker, let's talk about the feelings of loss people are experiencing. We've lost friends and relatives to COVID, but there has also been the loss of time and human connection with social distancing. How can people deal with these feelings?
Absolutely. It's been exceptionally challenging. I think the first step is really just to make sure that you recognize the impact that it's had and really allow yourself to grieve the losses that you may have incurred, whether it's the loss of loved ones or people, or like you mentioned, the loss of time or connection or other things that have just changed throughout the pandemic. And then I think it's about really being intentional about setting up connecting again with other folks. So as we're able to, get together more in safe ways, get vaccinated, all of the things that we know can help to protect us further, to really be able to engage with one another and try to get back to our regular routines of connection. That's very important.
Yeah, connection is so important, especially with your people, with your community, and
Yeah.
it's been a roller coaster of emotions for all of us. So how can people cope with stress and anxiety, and when should they consider seeking professional help?
Sure. So some of the things are just kind of making sure you're paying attention to the basics. So keeping a regular routine, getting good sleep, getting some movement. Doesn't have to be, extensive exercise. You don't have to go out there and, run 6 miles, but just making sure you're moving around, eating well. Also, like we just mentioned, just staying connected with other folks can all be very, very helpful in taking care of your stress and your mental health. In terms of when to seek professional help, if you really feel that your symptoms are impacting your daily life and you're not able to engage with your family at work, at school, that may be a sign that it is time to seek professional help. And certainly if you feel like your emotions are really out of control and in a very different place than they've been before, and especially if you're having thoughts about wanting to hurt yourself, you absolutely should immediately seek help.
Dr. Zucker, thank you so much for all of these tips. And I love that you were real with us before the interview saying we can all use these tips, even for you.
Absolutely. We all need some help now and then, and it's important to recognize that.
We're all in this together.
You know it.
All right. Thank you so much, Doctor.